and also regarding the antenatal care, intranatal care, postnatal care, and the problems which occur in the postnatal care. And commonly, the infections that are occurring during the postnatal period, that is mainly the puerperal infections, thromboembolic manifestations, etc. Now I am going to deal with the neonatal care, the care of the baby immediately after delivery. Okay. Here, the first thing is immediately after delivery, we have to look for the establishment of the and maintenance of the cardiorespiratory functions. Okay, and then the maintenance of the body temperature. And the infant was in the mother's womb with the warm temperature. After coming out from the womb, the baby will be exposed to environment. Either it may be very cold or very hot. The thing is, we have to maintain the body temperature of the infant is very, very essential. And avoidance of infections. Commonly, most of the infections which are transmitted from the mother to baby through transplacental transmission. These are some of the common infections that occur in the mother, especially the syphilitic infections or hepatitis or HIV infections, etc. They are easily transmitted from mother to baby through transplacental route. And establishment of the satisfactory feeding regimen. So that is, as you know, the immediately after delivery, the baby should be fed immediately after delivery, especially within half an hour. The baby should be fed with the breast milk. The breast milk, the importance of the breast milk I will tell later. And early detection and the treatment of some congenital abnormalities are acquired disorder and infections. So immediate care, here the immediate care is immediately after delivery, the baby should take care, first of all, so the clearing of the airways. That is more important, more because the secretions, the amniotic fluid, which is present in, which leads to hypoxia or which leads to breathlessness to the baby. The clearing of the airways is very, very important. By using the mucus sucker, you have to clean the nostrils and the mouth immediately after delivery. And we have to see the APGAR score. It should be taken at first 1 minute and then again at 5 minutes after birth. So that is the cleaning of the airway means we have to keep the head of the baby downwards and the legs should be elevated so that the secretions that are present in the nose and the mouth, it will be drained out. And then after sustain the respiration, now you have to look for APGAR score. So here the APGAR score is, you have to see the 5, that is the heart rate, respiratory rate, muscle tone, reflexes, and color of the baby. So you have to see if the heart rate is not present for within 5 minutes, that means we can declare it as the baby was dead. So this is very, very important. So we have to record the heart rate, we have to see the heart rate. And if the APGAR score is 9 to 10 means the baby is healthy, normal. And if the APGAR score is 0 to 3 means, the baby is severely depressed. Now, how to calculate the 0 to 3? That means, first of all, you have to look for heart rate, whether the heart rate is present or not, and the respiratory rate, and the muscle tone, whether it is a flaccid or flexions is present or not, and you have to look for reflex response, that is the reflex responsibility. That is, if you just strike the sole of the foot, so there will be reflex we can see, or if you just make a sound, the baby will be shows some reflections, and that is the normal reflection. And then color of the baby, whether it is blue or pale. If you see, the baby should be pink completely, that is the normal baby. Okay. And so if these are absent, heart rate is absent, respiratory rate is absent, muscle tone is flaccid, reflex responses are not seen, and the baby is blue or pale, that means the baby is severely depressed. So you can give the score 0 to 3. And if the baby's heart rate is less than 100, and the respiratory rate is slow and irregular, and the muscle tone is some flexion of the extremities, and the reflexes are grimace, and the body is pink, and the externals are blue, that means it is mild depression. That is, then we can give the score 4 to 7. And if the heart rate is more than 100, and the baby is actually the normal baby, immediately after delivery, the baby will cry. So here in normal, it is the good cry, and there will be active movements, and the reflexes are, you can see the cry, and the baby is completely pink. That means there is no depression. We can give the score 7 to 10. Nowadays, they are not giving much more importance to the APGAR score. Previously, they used to see the APGAR score. And so after that, you have to take care of cord, umbilical cord. Actually, you can see the pulsations in the umbilical cord. We have to tie and cut the umbilical cord after complete cessation of the pulsations. That means till that time, the baby will receive actually 10 ml of blood from the umbilical cord. So we had to wait for complete cessation of umbilical cord pulsation, and after that we had to tie and cut the umbilical cord. But in India, in the developing countries where the anemia is more common, in this way we can save the baby by procuring the blood from the placenta. And then afterwards it will rise and shrivels up and is separated, and it falls off. That is called aseptic necrosis, which takes place between 5 to 8 days. And then care of the eyes. Immediately after birth, the baby should clean the eyes from medial to lateral. Okay, so that is the infection. If there is any infection because the amniotic fluid and or something, it may infect the eyes. Commonly, we can see in some infections, the eyes will be infected, lead to conjunctivitis. The little margins should be cleaned with a sterile wet swabs from medial to lateral. Okay, and then we had to apply silver nitrate solution once, or application of tetracycline eye ointment. Thereby, we can prevent conjunctivitis in the baby. And if at all, if the eyes are not cleaned properly, immediately after birth, ophthalmic neonatal, which is commonly occurs if the mother is having any syphilitic infection. Chances of getting the infection to the baby, which leads to blindness, permanent blindness throughout the baby, throughout the life. So to prevent all these things, we have to clean the eyes immediately after delivery and apply the tetracycline ointment, 1% of tetracycline eye ointment to both eyes. And care of the skin. The care of the skin is very, very important, where the vermix caseosa that is present, which protects the baby to some extent. So immediately after birth, the baby should be cleaned, but previously they used to give the first bath between 12 to 24 hours. Nowadays, this method is removed, So first we have to clean the baby. The vermix caseosa which covers the baby should be cleaned by giving oil bath. Just apply oil, coconut oil or anything, and cleaned with a dry cloth. And bathing is not necessary for about 1 week if she had delivery in the hospital. And then afterwards, after 1 week or before discharge, you can give a bath and give it to the baby, to the mother. And one thing is because already the baby was in the mother's womb where there is a warm temperature, so exposed to the environment, so there will be cooling, either a cooling or a hot. So the baby exposed to the temperature, which is very, very dangerous. To prevent all these things, you have to cover the baby completely from head to feet. And maintenance of the body temperature is very, very important. So here, the body temperature, most of the body temperature, especially the baby, if it is a preterm baby or if the baby is malnourished or if the baby is low birth weight baby, so the temperature is easily exposed. The temperature is comes down immediately. So most of the 75% of temperature is goes from the head. That's why immediately after delivery, the baby should be covered from head to feet. And next, regarding the breastfeeding. So immediately after delivery, within half an hour or within 15 minutes to half an hour, if she had a normal delivery, the baby should be breastfed. So because the first mother which contains a colostrum, the colostrum will be secreted from the breastfeeding for about 3 to 4 days. The colostrum is very, very important, essential for the baby, which contains high protein and anti-infective things and the immuno antibodies, which protects the baby from acute respiratory tract infections and acute diarrheal diseases. So this is breastfeeding is very, very important. And if she had a cesarean section, because the mother is in a anesthetic, that is a sedation period, so it may require 1 to 1.5 hours to feed the baby. But if it is a normal delivery, the baby should be fed immediately after delivery, that is 15 minutes to half an hour. That is very, very important. So the breastfeeding protects the baby from all infections. And neonatal examination. Neonatal examination, first examination, it is made soon after birth, especially by the pediatrician. So here it requires a gynecologist, an obstetrician, a pediatrician to look after the baby. First of all, we have to ascertain the baby, whether the baby had suffered any injuries during the birth process. That is very, very important. So first we have to ascertain the baby in the first examination. And then we have to detect any malformations, congenital anomalies. Immediately after birth, we have to look after any congenital anomalies, especially the abnormalities like heart diseases or imperforated anus, etc. Because if there is an imperforated anus, means the baby requires immediate pediatric surgeon involvement. So otherwise, if time goes, the chances of death are very common. And then to assess the maturity. Here, we have to look for the maturity, whether the baby is of a full-term baby or a premature baby or a mid-term baby, etc. Because the premature baby requires a special care. Second examination, it should be done within 24 hours after birth. Here, we have to look for body size, weight, crown heel length, head circumference, and chest circumference. And as I told already regarding the body temperature, maintaining the body temperature is very, very important. The 75% of temperature will be lost from the head. So that's why immediately after delivery, the baby should be covered completely from head to toe. And then you have to look for skin. Is there any cyanosis of the lips or skin? Or is there any jaundice or any pallor or erythema or vesicular or bullous lesions, etc. on the skin? As you know, the cyanosis of the lips means some abnormality in the cardiac system, heart system. And then you have to look for cardiorespiratory activities. As you know, the cardiac murmurs. Is there any absence of femoral pulse? Is there any central cyanosis? And we have to look for the respiratory rate if it is more than 60 per minute. And you have to look for thoracic cage. Is there any retraction on inspiration? That means if there is any retraction of the chest wall means something abnormal in the lungs or the chest. And you have to look for the neurobehavioral activities. That is posture of the neck, any retractions or the frog-like posture or any hyperextension of the limb or hyperflexion of the arm limbs and asymmetrical posture and muscle tone in the tendon reflexes, cry movements, etc. That indicates you see the neurobehavioral activities, means is there any convulsions, that is the posture of the neck, whether the neck is normal or straight, rigid, etc. And head and face. So we have to examine whether there is any hydrocephalus or any large. For hydrocephalus means you have to look for fontanelles. Is there anterior fontanelle will be actually the anterior fontanelle are not closed after delivery, but in hydrocephalus they still it is very white, the anterior fontanelle, and there will be prominent scalp veins you can see, and also you have to examine the eyes. Is there any congenital cataract in the baby? Or is there any coloboma? Or is there any conjunctivitis, etc.? We have to examine the eyes properly. And then ears. Is there any dysmorphism or accessory auricle or preauricular pits, etc.? And we have to look for mouth and lips, that is a hair lip and a cleft lip and cleft palate, etc. So these are the common congenital anomalies we can see in the babies. That's why if it is present means we have to take care immediately to prevent the complications. And abdominal signs, that is the distension of the abdomen. Is there any abnormal masses and is there any imperforated anus? That that shows the quick action on in the baby to prevent the complications. And then limbs and joints deformity. You can see the deformities of the joints, especially the congenital dislocation of hips you can see, and extra digits that are present in it. So the congenital dislocation of the hip, you can look for immediately after birth. That is, sometimes previously they used to say that if there is any congenital anomalies, so you have to correct even during the delivery also if it is a normal delivery. So that is more important. You have to take care of the congenital dislocation of the hip. So how to find out the congenital dislocation of the hip? That is in by flexing the thigh and do the adduction to abduction. From abduction to adduction, move the limb from abduction to adduction in flexing the thigh. If there is, by doing the abduction to adduction, if there is any click sounds we hear, that means there is a congenital dislocation of the hip. It should be corrected immediately if you found any dislocation. And then spine, that is neurospinal defect, you have to look for And external genitalia, that is the hypospadias or any undescended testis or hydrocele, congenital hydrocele, or in females you can see fused labia and enlarged clitoris. These are the common abnormalities in the external genitalia in the child, in the baby. And regarding the newborn care. So here, the newborn care, the infected newborn, you can see the infection that occur in the newborns, that is the neonatal infections, is the main cause for the neonatal mortality in many developing countries. Here, the common contributing factors for the neonatal infections is it may be due to poor hygiene or due to premature rupture of the membranes. So here the infections are more common in premature rupture of the membranes. So that's why in premature rupture of the membranes we have to give antibiotics to prevent the infections in the newborn. And transplacental contamination is the more important cause of infection in the newborns. That is, of course, as I told already, the infections are easily transmitted from mother to child, most of the infections. And also, the infections can also be transmitted through unhygienic practices during the delivery. That is, cutting the umbilical cord with the infected blades or the infected knife, etc. They also causes the infection to the neonates. And the main thing you can see, the neonatal tetanus, that is called the seventh day fever. Most of the neonates died previously. Most of the neonates died on the seventh day because of tetanus. That is called neonatal tetanus. Nowadays, we are not seeing any neonatal tetanus cases because most of the pregnant women are vaccinated by tetanus toxoid during their antenatal period. So that will prevent the neonatal tetanus in the infants. And congenital syphilis. As you see, the congenital syphilis, that is, the syphilis is easily transmitted from mother to child. So that's why during the antenatal period, we will take the blood test or blood for VDRL. If the mother is VDRL positive, means we have to give insulin injection to the penicillin injection, that is a procaine penicillin, 6 lakhs international unit daily for about 10 days. Thereby, we can prevent the infection in the mother. Thereby, we can prevent the transmission of infection from mother to child. If at all the baby had any congenital syphilis, we had to treat with the 2.4 to 4.8 million units of benzoyl penicillin to the baby. And the newborn with hepatitis B positive mothers. If the mother is hepatitis B positive, the infection is easily transmitted to the baby. So that it can be prevented by giving the immunoglobulins. That is a 20%. If we see hepatitis S is positive in the mother, the 20% of infection is transmitted to the baby. If the hepatitis E antigen is present in the mother, means 90% of infection will transmitted for the baby. So that's why. So if the mother is hepatitis B positive, so the we have to give the hepatitis B. Seroprophylaxis commonly seen. So we have to give 2.5 ml of hepatitis B immunoglobulins to the baby, and afterwards the 2 ml of a specific vaccine, and then we have to continue for 3 days, 3 doses, 6th week, 10th week, and 14th week to prevent the infection of the hepatitis B in the babies. So if the mother is hepatitis B positive, you have to give zero point 0.5 ml of immunoglobulins, hepatitis B immunoglobulins to the baby, and then after 12 hours of birth, and then give 5 ml, 2 ml of hepatitis B vaccine to the baby. This vaccine should be continued from 6th week, 10th week, and 14th week. 3 doses of hepatitis B vaccines to be given to the baby to prevent the infection, hepatitis B infection in the baby. And the newborn with the HIV positive mother. If the mother is HIV positive, 30% of babies will born with HIV. So the positive mothers are infected, but whether the mother should give breastfeeding or not is not yet decided. Whether it is contraindicated. Somebody is telling that already our children, especially in the developing countries, the babies are of malnourished babies. So the breastfeeding itself gives some protection to the baby, even the mother is having a HIV infection. But some says it is contraindicated, but only 0.3% of HIV present in the breast milk is transmitted to the baby through the breast milk. Somebody says that some schools says that it is contraindicated. Some schools say that because in developing countries the babies are already malnourished, so that requires the breastfeeding, which contains a somehow some proteins and the antibodies which protects the baby. And but the thing is, BCG vaccination should not be given to the baby if the baby is born to a HIV positive mother. And then the measuring the baby. The birth weight, it should be taken within the first hour of the life, immediately after delivery, within the first hour. And the baby should be weighed with in a naked body. Keep it in a clean cloth in the weighing pan. If the baby was delivered in the home, the weighing machine may not be available. So better to weigh the baby in Salter's weighing machine if she had an arm delivery in the home. And the length should be recorded within the first 3 days by infantometer by fixing the foot and measure the from head to foot. And head circumference. Head circumference should be measured from anterior to posterior frontalis, and then the chest circumference should be measured to the baby. Actually, the at birth, the head circumference is more than chest circumference. And after 5 months, it will be equal, and afterwards, the chest circumference is more than the head circumference. But at birth, the head circumference is more than the chest circumference. And the neonatal screening. Neonatal screening means, so you have to take the 10 to 15 ml of cord blood. It should be collected at birth and saved in a refrigerator for 7 days. And you have to look for the typing and the Coombs testing, and also test to detect some any congenital and inherited hemoglobinopathies and the congenital anomalies, etc. And commonly you can see the anomalies that is that is called the phenylketonuria, which is common. It is an autosomal recessive trait. Here, the deficiency is phenylalanine hydroxylase. This phenylalanine hydroxylase is important to convert convert the phenylalanine to tyrosine. So, if the phenylalanine hydroxylase is deficient or absent, so there will be accumulation of phenylalanine where it doesn't converts from phenylalanine to tyrosine. So here this accumulation in the blood which leads to mental retardation and a tendency of seizures, etc. So how to prevent the phenylketonuria? So we can prevent this if at all the baby born with the phenylketonuria because of it is an autosomal or recessive trait. So we have to give phenylalanine. And then neonatal hypothyroidism. You can see the neonatal hypothyroidism. For the mother is hypothyroidic, the chances of getting the neonatal hypothyroidism in the babies. So here, which leads to severe mental retardation. So the hypothyroidism leads to mental retardation. Can be prevented by treating with first 1 to 2 months of life. So if you identify the neonatal hypothyroidism, you have to treat first within first 1 to 2 months of life. And then Coombs test. This is done routinely on all infants of all Rh negative mothers. I told already regarding the mother is an Rh negative. And if the baby is also Rh negative, it's okay. Otherwise, if the baby is Rh positive, so the chances of as a transmission is seen in the Rh negative mothers. And sickle cell or hemoglobinopathies, we can see the agargal electrophoresis, which is done in infants whose mothers have sickle cell or other hemoglobinopathies. That is commonly seen in thalassemia, glucose 6 phosphate dehydrogenase deficiency, etc. And then, as I told already, the congenital dislocation of hip. That is, this test consists of manipulating the hip immediately after birth, the childbirth, by adduction to abduction while the thigh is in a flexed position. I hope you can understand what is thigh should be in a flexed posture, and we have to move the leg from adduction to abduction. And a positive or an abnormal result is indicated by click or a snap being produced during this test. If there is any click sound means there is some abnormality. It should be carried out to all the babies up to 6 to 14 days after birth and monthly interval until the child is at 4 months age. And who are the at-risk infants? It is commonly asked by the short nurse or in orals. Who are the at-risk infants? At-risk infants means, hello? At-risk infants means the birth weight is less than 2.5 kgs. Even the birth weight is 2,499 grams, we can call it as a low birth weight baby. So if the birth weight is less than 2.5 kgs and twins and birth order is more than 5 and artificial feeding baby and weight is less than 70% of expected weight and failure to gain the weight during the 3 successive months. They are all the comes under high risk infants. And the children with the protein energy malnutrition and diarrhea and working mother or one parent, they are all the comes under the high risk infants. So high risk infants are birth weight less than 2.5 kgs, twins, birth order is more than 5, artificial feeding, weight less than 70% of expected weight, and a failure to gain weight during 3 successive months, and children with protein energy malnutrition and diarrhea, and a working mother or one parent, they are all comes under high risk infants. And the next you can come to late neonatal care. So here the late neonatal care is mostly the complications in the neonates are, you can see the diarrhea or the pneumonia, malnutrition, etc. So here you can see the if the baby is less than low birth weight babies, they are mostly prone for acute diarrheal diseases and also pneumonia and malnutrition. So diarrhea leads to malnutrition, malnutrition leads to diarrhea. It is a vicious circle. So the low birth weight babies are more prone for diarrhea or acute respiratory tract infections, or acute diarrheal diseases and malnutrition. So you can see the low birth weight babies. Low birth weight babies means if the normal birth weight is 2.5 kgs, if the baby is born with less than 2.5 kgs, within first hour of life, you have to weigh the baby immediately. If it is less than 2.5 kgs, means the baby is low birth weight baby. So we have to assess whether the baby is a preterm baby, term baby, or post-term baby. Preterm baby means you can call it as a extremely preterm baby, mid-term preterm baby, or late preterm baby. If it is extremely preterm baby means if it is less than 28 weeks of pregnancy, 28 weeks of pregnancy, and the term means between 28 to 32 weeks of pregnancy, and late term means 32 to 37 weeks of pregnancy. And post-term means it is more than 42 weeks of pregnancy. We can call it as post-term babies. So preterm babies means they are the babies born before the weeks of gestation. So the intrauterine here, the intrauterine growth may be normal, but the weight, length, and the develops for the duration of the gestation. And so, what are the causes for preterm babies? Are the low birth weight babies? Here, the causes are it may be due to multiple births, or any acute infections, or hard physical work, or any comorbidities like hypertension or diabetes, non-communicable diseases, etc., which are the causes for low birth weight babies. So, what are the preventive measures? That is, good prenatal screening and care, and discouragement of adolescent pregnancy, and treatment for hypertension. And another thing you can see, small for dates baby. These are as a result of which leads to intrauterine fetal growth. So the causes for small for dates babies is which may be due to malnutrition, it may be due to severe anemia in the mother, or heavy physical work during the pregnancy, and it may be due to hypertension. And as you know, the malaria, which is endemic in India, so if the mother is having had a malarial infection, which leads to small for dates baby, or it leads to low birth weight babies, and toxemias of pregnancy, and also smoking. And short maternal stature, and a very young age, and close birth spacing. As I told already, the birth spacing should be at least 3 years gap between the first pregnancy and the second pregnancy. If the birth spacing is very short, less than 2 years or less than 3 years, so prone for the low birth weight babies or the preterm babies. And placental insufficiency and placental abnormalities. So the placental insufficiency means, as I told already the previous case during the antenatal care, if the mother is having the habit of smoking, so that the smoking reflects the growth retardation of the baby. It is due to the placental insufficiency, where the smoking which contains the nicotine, which causes the narrowing of the blood vessel, so the blood supply will be minimized, reduced because of this narrowing of the blood vessels. So which leads to placental insufficiency or placenta abnormalities, and then fetal abnormalities, etc. And then intrauterine, some infections, intrauterine infections, and chromosomal abnormalities, and multiple gestation. So the low birth weight. So these are the causes for low birth weight babies. That is short maternal stature, very young age, close birth spacing, and placental insufficiency, fetal abnormalities, and intrauterine infections, and chromosomal abnormalities, and multiple gestation. So how to calculate the low birth weight babies? It is percentage of the low birth weight babies equal to live born babies with weights less than 2.5 kgs by total number of live births into 100. We can calculate the low birth weight babies. Here, if you see the incidence rate of the low birth weight babies globally, it is 25% low birth weight babies born each year, out of which 95% are in developing countries. Here, in India, it constitutes about 26%. The target is to reduce the incidence of the low birth weight babies by 10%. So, what are the risk factors for the low birth weight babies? The risk factors for the low birth weight babies are malnutrition. The foremost thing is low birth weight babies are prone for malnutrition, and malnutrition itself leads to infections, or the low birth weight babies leads to infections and unregulated fertility. The importance of low birth weight babies are it is associated with some mental retardation. There is a high risk of perinatal and infant mortality and morbidity. So the low birth weight babies are more prone for perinatal and infant mortality and morbidity. Here, the infant mortality is 20 times greater for all the low birth weight babies. 20 times the infant mortality rate is 20 times greater for all low birth weight babies. They they become victims of phenylalanine malnutrition and infection. Caller, caller has a mic. Okay. What does it mean? Because of internet issue, people need to come back. They come back. Okay. So they become victims of protein energy malnutrition and infection in the low birth weight baby. So here, how to prevent the low birth weight babies. This number one is good prenatal intervention programs rather than treatment for low birth weight babies. So first of all, we have to prevent the low birth weight babies by giving good prenatal care during the antenatal period. If the mother is not malnourished, if the mother is not anemic, so we can prevent. We can prevent the low birth weight babies. So the antenatal care is very very important. As I told already, the non-communicable diseases like hypertension and diabetes is prone for low birth weight babies. So that's why if the mother is diabetic or hypertensive, first we have to treat it during the antenatal period. And some of the intervention programs also we can prevent the low birth weight babies. So what are the intervention programs? One is direct intervention, another one is indirect intervention. The direct intervention means increasing the food intake by the pregnant mother. That is, as I told already regarding the antenatal care. So we are having the centers in the all villages. That is which provides the nutritious food to the mother during the antenatal period. That is increasing the food intake during the pregnant mother and controlling the infections. If the mother is having any infections, we have to treat the infections during the antenatal period. That is commonly you can see the syphilis. That is we have We will take the blood for a VDRL examination. If the mother is having the VDRL positive, means we have to give treatment for the syphilis by giving procan penicillin 6 lakhs international unit for about 10 days. Thereby, you can prevent the infection. It is controlling the infection during the antenatal period itself. And then early detection and treatment of medical disorders. So we have to detect the babies during the early detection during immediately after delivery. And then during the antenatal mothers, if the mother is having any complications, so some heart diseases, etc., should be detected and treated. And indirect intervention is family planning. That is, by providing this, by observing the spacing between the first pregnancy and the second pregnancy, about 2 years or the 3 years, by observing the family planning methods, that is the spacing methods, so thereby we can prevent the malnutrition in the mother itself. That is by observing the family planning methods. And then avoidance of smoking. I told already, because of smoking, the tobacco itself contains the nicotine, which causes the narrowing of the vessels, leads to placental insufficiency, blood supply to the baby. So this should be avoided by, this should be prevented by avoiding smoking during the antenatal period. And improved sanitation measures. That is, that itself leads to diarrhea and malnutrition, etc. So you have to improve the environmental sanitation, etc. And then measures aimed at improving the health and nutrition of the young girls. That is one of the indirect intervention. During the young girl itself, you have to improve the nutrition status of the girls. So thereby you can prevent the complications during the delivery. And then maternal leave with the full wages, as I told, that is mother antenatal mothers. The postnatal period, there will be maternity leave for the postnatal mothers, especially for about nowadays they are giving 6 months maternity leave with the in the employees. And then child benefits. These are all the indirect interventions. We can prevent the low birth weight babies by direct intervention and indirect intervention. Treatment is incubatory care and the feeding and prevention of infections. Okay, that is incubatory care means if the baby is low birth weight baby, that baby requires an incubatory care. And also that baby requires the feeding, special feeding practices. So here, the feeding practice is a breastfeeding. If the baby is breastfeeding, we can improve the health status of the baby. Even though the baby was born with a low birth weight baby, that baby requires breastfeeding immediately. That is, it should be an on-demand process. So whenever the baby cries, the baby should be fed with the breastfeeding. That is very, very important. If the mother dies, that baby requires the artificial feeding, which equals to breastfeeding. With the breast milk. What are the how much proteins, nutrients present in the breast milk, that should be replaced by giving the artificial feeding to the baby if the mother dies. And prevention of infections. As I told already, if the mother is having any infection, it should be prevented by diagnosing during the antenatal period and treating the antenatal mothers. So here, what are the causes for deaths in the low birth weight baby? Here, so the low birth weight babies is an essay question, or they may ask in the viva. So the low birth weight babies is very, very important. So what are the causes for deaths in the low birth weight babies? The causes of deaths are atelectasis. So because the rest lungs are not completely, may not be developed properly, which leads to atelectasis or malformations or any pulmonary hemorrhage are intracranial bleeding and pneumonia. So these are the causes for deaths in the low birth weight babies. Here, the causes for deaths are atelectasis, there are the malformations, pulmonary hemorrhage, intracranial bleeding, and pneumonia. And the feeding of the infants. So the breastfeeding. Here, the breastfeeding, so immediately after birth, the baby should be fed by breastfeeding. So the breast milk contains the colostrum, as I told already. Colostrum is very, very important to the baby, to the infants. Here, because the colostrum contains antibodies and anti-infective agents. Exclusive breastfeeding for about now nowadays they are telling for about 6 months, not 4 months. Exclusive breastfeeding for about 4 months to the baby. Exclusive breastfeeding means only breast milk, nothing else. Even a drop of water is not necessary for the baby for about 6 months. Even though in summer season also the baby doesn't require water for up to 6 months. Only breast milk for about 6 months. The most of the parent mothers they will ask how many months I have to feed the baby. So we have to tell you only for about 6 months we have to give only breast milk, nothing else. And whenever the baby cries, mother has to feed the baby. That is on demand, not a time bound process. So mothers will ask how many times I have to feed the baby. So whenever the baby cries, maybe mother should feed the baby. That is called on demand, not a time bound process. So exclusive breastfeeding means only breast milk, and the breast milk should be on demand, and it should be continued for about 6 months, and it should be started immediately after delivery. That is within 15 minutes to half an hour in primary, and within 15 minutes to half an hour in a normal delivery, within 1.5 hours for a cesarean section. And Indian mothers secrete for about 450 to 600 ml of milk daily, 1.1 gram of protein, and 70 kilocalories for 100 ml. And I told already the breastfeeding should be on demand, not a time. So advantages are the breast milk are very, very advantageous because it is a safe, clean, hygienic, cheap, and available to the infant at correct temperature. And it fully meets the nutritional requirement for the infant in the first few months of life. It contains antimicrobial factors and macrophages, lymphocytes, IgA, and antistatical factors, lysozyme and lactoferrin. It protects the baby against diarrhea and also against respiratory tract infection, necrotizing enterocolitis in the first month of life. Easily digested, and it is utilized by both the normal and premature babies. It promotes the bonding between the mother and infant. And the sucking is good for baby, so it helps for the development of the jaws and teeth. And it protects the baby from the tendency to the obesity. And it prevents malnutrition and reduces the infant mortality. Thank you very much. More. It's over now. Thank you very much. It's already 1 hour. I have taken correct 1 hour. Correct?